Welcome to another edition of the Living Well podcast. I am Dr. Mahesh Menon, and with me today we have a very interesting guest who is a cardiologist, and we are going to have a discussion on some of the matters of the heart with him. We have with us Dr. Venkat. Dr. Venkat's a very dear friend. We've worked together in the past, and he's a unique phenomenon in the sense he's an electrophysiologist and an electrocardiologist. Let us explore what it means, and we are going to be talking about a lot of topics related to the heart. So, welcome, Dr. Venkat, to our podcast.
Thank you, Dr. Mahesh. That was a very generous sort of introduction.
No, it wasn't even generous because if I were to explain to somebody that I am a pain management doctor, the first question they ask me is, how do you do that?
Yeah.
So if someone asks you, you are a cardiologist, and what is someone who works with electrophysiology and electrical activities of the heart, how does one become what you have become? What is the career trajectory?
Yes. So I am a cardiologist basically, and then I subspecialized into a branch called as electrophysiology. So electrophysiology is a branch that exclusively deals with the electric circuits inside the heart.
Okay.
So people are quite aware that you can have chest pains, which cause angina, which is called angina, and then they can go on to have heart attacks. And that is caused because of the problem with the blood supply to the heart. So heart has three main blood vessels that supply blood to the heart. So by and large, for people, a heart disease is equivalent to heart attack.
So heart attack is heart. There's only one problem with the heart, that's heart attack.
Heart attack. But you got to appreciate that our heart is beating right from our birth to death. So this is like a double engine. Heart has four chambers.
Correct.
There are right side, there is the right top chamber, bottom chamber, which act as an engine. And on the left side, there is a left top chamber, bottom chamber. So these are two engines brought together. It's the marvel. It's a God's marvel, because if these engines stop for 4 seconds, a person loses consciousness. So in our lifetime, this heart is beating more than 1 billion times without actually stopping.
Yeah.
So where on earth can you manufacture an engine which will not stop and which has to continuously function? So this, everybody is endowed with it. People take it for granted.
People know it. People say my heart beats.
Yes.
They say mera dil dhadakta hai, my heart beats. But this is what makes it beat. Though there is an electrical system inside the heart which is giving signals, and you're not responsible for it. It is going on. It's an automatic system.
Yeah.
And that beats from birth till death, as you rightly
And if you think about it, it's actually mind-boggling, because per minute our heart beats something between 60 to 100 beats.
Correct.
And take that into an hour, 3,600. In a day, 24 hours, 84,000 times. And take that into 365 days. And then the lifespan, 60 to 80 years, or even now 80 to whatever, 90 years.
plus, yeah.
It is beating more than 1 billion times. So even skip of a few beats for 4 seconds, all that it takes is, if your heart doesn't beat for 3 seconds, the brain doesn't get much in the way of blood supply, and you lose consciousness.
So that's the interesting part that you mentioned. So we've heard of this thing that heart beats, my heart beat, and there are songs about it in popular culture. Dil dhadakta hai, dhak dhak karne laga, for example. There's so many things associated with the heartbeat.
Yeah.
And you're also telling now that there are instances when the heart can skip a beat, which is also used. My heart skipped a beat. We use this term. And then you're saying that if the heart stops, the beat stops for about 4 seconds, there is the chance of you losing consciousness. Yeah. So is that why people say they faint and things like that? What happens?
Absolutely. That is one of the reasons. The ultimate mechanism is decrease in the blood supply to the brain. That can be because of a drop in blood pressure or because of drop in a heart rate. So that is the ultimate mechanism. But going back to what I do, so heart has got a lot of electrical networks inside. And electric powerhouse of the heart is in the right top chamber. That's where your heartbeat starts. And that spreads down to the bottom chambers. There is a junction box between the top and the bottom chambers. Now, this electrical powerhouse in the right top chamber is called a sinus node, that is richly supplied by the nerves that increase your heart rate. Somebody is shouting at you.
So that's the pacemaker of our heart.
Pacemaker of our heart. So that is very sensitive to the nerves. So if you are trying to exercise, if you're trying to run, or if you are mentally stimulated, or
you're afraid,
flight or fright, then the sort of sympathetic nerves, the nerves that increase the heart rate, tend to increase. And similarly, when you're sleeping, then there are nerves that can decrease the heart rate. Your heart rates go down. So whenever there are electric circuits, something can go wrong with it. So there are extra connections between the top and the bottom chambers of the heart in sort of young people, where instead of your heart rate being 80, it can be 160. Suddenly, so you find one moment, the next moment you see that your heart is racing at a rate of 160 or 170. So that's called as palpitations. So people experience their own heartbeat. So, and we in sort of medical terms call it as palpitations. So just to put it in simple terms, you and me, whilst we're sitting, we don't feel our heart beating.
Yeah, we don't feel the heart is beating.
Yes.
Unless you're like running and you feel a dum dum.
Yes, the moment we run, you feel your own heart beating. But some people, without doing anything
they feel
sitting, they feel it. That sensation is called palpitation.
Palpitations.
Yeah. So my job is in people who have these problems with with the conduction system of the heart.
Correct.
We can diagnose where that problem is and we can treat it. And the way we do it is very simple. It's like an electrician coming to your house.
So these are the electricians of the heart. There are two systems. One which is responsible for the heart attack when the blood supply to the heart stops, causing a heart attack. And one is the rhythm going abnormal, which is the electrical activity. So you are specialized in managing the electrical activity.
Electrical activity, yes. And I have to, because whenever we go to the meetings and I give this example, it doesn't sit well with my interventional colleagues. They say you can call yourself an electrician of the heart, but you know,
don't call us down. But I'll tell you something, that with artificial intelligence coming in nowadays, in the next 20-30 years, it's just these hands-on jobs which are going to be the most paying, because everything else AI is going to be doing. But that's a different segue actually into our conversation.
Just going back on that AI thing, I think there is no replacement to empathy, human touch. And a lot of times I have seen when I'm treating a very complex patient, if I am treating two complex patients, and both are exactly the same, one would respond very well and other may or may not. The pure reason being, I see that the person that respond are the one who trusts their doctor, who are very positive. So this is very difficult to prove, but that doctor-patient relation and the empathy, sympathy, the trust that you put in the doctor itself acts as a medicine.
So this is something wonderful that you have actually said, that from your clinical observation over the last many years, you feel that people who have a positive approach, a positive vibe, they have trust and they have a good bond with their doctors, and it works both ways.
Absolutely.
The outcomes are usually better, and
absolutely. So just going back about this electrophysiology, because that's my field, so I keep going back to it. So we do something called as an electrophysiology study. So this is a procedure that is done in a conscious patient. We just give some local anesthetic in the groin, introduce these wires through a vein that goes from your leg to the heart, place these wires in different positions in the heart and try and study the electrical circuits in the heart. And if we find that there is a problem, if there is an extra connection, we try and deal with it by delivering radio frequency waves, which destroy that millimeters of tissue. It's just like microwaves heating the food. Radio frequency waves just destroy that little millimeters of tissue, which is causing the problem.
So now the approach is someone who gets, say, an extra awareness of the beat. They feel that the heart is beating abnormally, and you feel that there is a electrical problem with the heart circuit. You can diagnose it with, like, say, a number of tests. ECG would be the first, I guess, and that's the first baseline, and then there are many other tests.
Absolutely, and because we are living in this age of artificial intelligence, see, previously one of the problems was the patients would come to the clinic, and when they are in the clinic, they're absolutely fine. They've got a normal heart rate, you do the ECG, everything is fine. Once every 4 days, they get these 5 minutes of palpitations. In some people, once every 3 months. In some people, once every 6 months. You really need a monitor on you when you are having the symptoms. Otherwise, it's impossible to diagnose. But with AI now and the Bluetooth technology, telecommunications technology, all these have developed so much. We can monitor people just by applying a simple patch on the chest. So that is continuously, there is a little chip inside that is continuously recording the heart rate. That chip communicates with the patient's mobile phone, which is then relayed to a remote center, which is looking at the heart rhythms.
And how long can it be, sorry to interrupt, but how long can it be kept for?
The patches can be left for a week.
Okay, that's the maximum?
And then you can put a new patch.
Okay, so you can continuously keep it so that you don't miss out on it. If it's happening
Yes.
only once in 20 days, you can
Yeah.
pick it up. And how accurate are the wearables that are there nowadays in terms of
Wearables as well. Again, you mentioned about artificial intelligence. We have this wearable technology only purely because of artificial intelligence, because the amount of data that a wearable watch collects is unbelievable, because it's taking every heartbeat, and it is humanly impossible to sort of sift through much data, so much data. And it is because of this AI, which is a big data science, it is able to go through all this and then come up with a diagnosis or algorithm. So the watches themselves, since the watches have come, we have a lot of patients coming in saying that we have heart rates of 140, 150. That is your normal heart rate going up when you exercise. But equally, we are able to pick up patients with heart rhythm abnormalities because these watches can record the
So it
heart
is
rate.
useful, isn't it?
Absolutely, absolutely. But you got to keep in mind, the watch is there only to sort of suggest there is a problem. It is not a medical grade device.
So they
you
shouldn't
cannot
panic. They can just take an expert opinion. They shouldn't
Yes,
panic. They can
yes.
just come and take an expert opinion and sort it out.
Yes, and then there are medical grade sort of devices which the doctors can rely on diagnosing. So those are the cardiac patches,
They're
and
more
then
accurate and
yes,
so
and
on.
then there is something called as a loop recorder as well. It is like a small pen drive like device which we can implant under the skin. There are no wires, and the battery lasts for 3 years. So if the patient were to have any electrical disturbance in the next 3 years, we are able to pick it up. So all this has come up in the last few years thanks to all the developments in the technology.
So it's an interface of engineering meets medicine, where it's like an
Absolutely.
amazing example for that.
Absolutely. So just going back to the people with these heart rhythm problems, previously, few years back, they used to be put on tablets which can drop blood pressure, drop the heart rate, and they had to suffer taking these tablets all their life. Now, with this new electrophysiology study and radiofrequency wave ablation, you try and sort the problem out. The patient is no more a cardiac patient. They don't need to see the cardiologist.
So it's cured. It's as
It
good
is
as
cured. It is cured. A 20-year-old lady who would have otherwise been on tablets for the rest of the life with all the side effects, one small procedure and she's cured for life.
So this brings me to the next, the more important part, because I did a YouTube discussion with a stand-up comedian, and we were discussing a few things about health matters and the sudden cardiac deaths. You hear this, oh, young person who was working out at the gym suddenly died. Someone here had something, suddenly died. In a wedding function, suddenly dropped dead. There are a couple of questions here. We want to discuss this actually in terms of, is there a rise in cardiac death in youngsters in our country, in India?
Sure. I think since you brought up sudden cardiac death, let's try and define this sudden cardiac death.
Sure.
See, when a patient dies, whatever the cause, the ultimate modality of death is the heart stops.
Yeah.
Okay, that is a cardiac death. Why do we call it as sudden cardiac death? Sudden cardiac death, by definition, is if somebody has had onset of symptoms and within 1 hour the patient dies. That is called
A
sudden cardiac death. Okay. Or nobody has seen the patient in the last 24 hours, and before 24 hours he was absolutely fine. And then the next thing we know is that this patient is dead.
No more, yeah.
It is called sudden cardiac death. In an overwhelming majority of cases, the sudden cardiac death is caused by the heart disease.
The heart itself has some problem.
Some problem which is causing the sudden cardiac death. There are other causes, a massive clot going into the lung, a big cerebral bleed. These all can cause sudden cardiac death. But in a vast majority of cases, it is the problem within the heart. And again, 80 to 90% of the problems with the heart are because of problems with the blood supply to the heart.
Which is the heart attack, which is...
Yes, but there are 10% of people in whom, probably less than 10%, in whom the sudden cardiac death is not because of a heart attack. So people a lot of times get confused with sudden cardiac death and heart attack. Heart attacks can cause sudden cardiac death, but not all sudden cardiac deaths
are because of the heart attack, because of the blood supply problem.
Yes.
So how many people have rhythm disorders which cause sudden cardiac death?
Yes, there is a proportion of people who are prone, who have got heart disease, like they've previously had a heart attack, or they have disease of the heart muscle which causes weakness of the heart muscle. That's called as cardiomyopathy. So normally when we do a test called as an echocardiogram, this is an ultrasound scan of the heart, just the same scan that a pregnant woman have to have a look at the baby. We do for the heart to look how well the heart is pumping. And in that we mention a word called as ejection fraction. This is very important, EF. So if you are a known heart patient, you need to know what is your EF.
Ejection fraction.
Ejection fraction. The normal is more than 50%. If it is 45 to 50, then it's a mild dysfunction. 35 to 45 is a moderate, but less than 35 is severe dysfunction. That is very important figure, because once you have severe dysfunction, when your heart is not pumping as much as it should, your heart is prone for electrical disturbance.
So the rhythm disorder automatically can happen.
And that can cause cardiac arrest. So for that, we implant a special type of pacemaker called as a defibrillator. Because it's impossible for somebody to carry this defibrillator all the time, where you can shock your heart whenever you lose consciousness. So we're going to implant a small device which is about 70 grams under the skin and a wire going into the heart. The wire this device is keeping keeping watch on this heart rhythm. And the moment it goes abnormal, it can shock the heart back.
So it can detect the rhythm and it can pace accordingly and defibrillate as required.
Yes. Those are one category. And then you have these people who are born with various abnormalities. So they are born with congenital abnormalities which can cause problems with electrolytes, which can cause problems with conduction system in the heart. There are a lot of channels inside the heart. There are sodium channels, potassium. So this is extremely complex, but let us say some people are more prone for cardiac arrest.
So if I were to just there are some of our listeners who are not doctors, and if they want to understand this, if I were to ask you, what percentage of people who might be having a sudden cardiac death, like working out in a gym, is it safe to work out in a gym, or do you think that working out in a gym increases the risk of heart attacks?
Sure. So that takes us back to the point, what is your risk of having a heart attack? And again, what age are you and what are your risk factors? So if we talk, let me answer your question that you said that you wanted to go to a gym. So if you're a 45-year-old male and you've not been following the good lifestyle, and suddenly you wake up one day and you think, look, tomorrow onwards,
1st January, so I have to go now.
I'm going to go to the gym. So we don't know whether you have underlying diabetes or raised blood pressures, you have underlying heart disease. And then you go to the gym and you start running on the treadmill, and day one you want to do really well. So you are putting a stress on your heart, already diseased heart, which you are not aware of. And you are triggering various wrong things with your heart. You can have
You're
a heart
putting
attack.
that engine under stress if it's not used to any activity.
So my advice is, if somebody wants to go and exercise in a gym and you are a middle-aged person, it is a good idea to have a few tests first done, or at least look into your own risk factor profile. Am I diabetic? Have I got high blood pressure? Have I got a family history of heart disease? Is my cholesterol, is my lipids in the blood, are they okay? Or have I had any symptoms lately? See, a lot of times people say sudden cardiac death because he has absolutely been fine and then the next minute he's dead. But there has been a study where they took all these sudden cardiac deaths and interviewed their family members. These people did have symptoms. They did have a mild chest pain. Some people had mild exertional shortness of breath, but they sort of ignored them. Okay, I have got a meeting today, I have to go, let me just postpone it to next week. I can go and see the doctor. And then this guy goes to the office and in the meeting has a sudden cardiac death. People say he's absolutely been fine.
He was fine
and suddenly. So the most important message for your viewers is that do not ignore symptoms. So what are the cardiac symptoms? If you have any chest pain, any form of chest pain, sometimes when I'm in meeting, people ask me what type of chest pain is coming from the heart. I say any form of chest pain.
Any chest pain.
Because in my last 30 years of experience, I've seen all forms of descriptions of chest pain which turned out to be heart disease. And sometimes people give a classic description and they may not have. So I wouldn't go too much by the history, but if you have any form of chest pain, you should not ignore. You should go to the nearest casualty or hospital. They will do a blood test to see at least there is immediate problem with the blood supply to the heart. They'll do an electrocardiogram. They'll stick some electrical leads on the chest and then see whether your rhythm is okay. Are there any changes? These are the basic tests. And then the next step, they may organize an echocardiogram, which is an ultrasound scan of the heart to look at the valves, how well the heart is pumping, and they may also book an appointment with the cardiologist. So this, if you are experiencing chest pain or shortness of breath or exertional shortness of breath, or if you're experiencing palpitations, which is awareness of your own heartbeat, or if you're feeling dizzy, or if you lost your consciousness for a couple of minutes or longer than that.
Really red flags, so to speak.
These are absolute red flags. If you are going to ignore these, it is like you're driving a car and your brake suddenly fails for a second and then starts working again. What would you do? You would panic, you would stop and say, look, I'm not going to drive again. The same with your heart. You cannot take a chance and you may not get a second chance.
You may not get a second chance.
Yes.
So coming back to this, so you mentioned some of the symptoms. And what about the lifestyle itself? What about things like, what are the things in lifestyle that someone should do to have a healthy heart,
Yes. So traditionally, our belief was heart disease is a disease of the old. 50 years, 60 years. But I will remind the present generation that your lifestyle is nowhere near what your grandfather's lifestyle was. They did not have this much stress. They did not have this much social media. The present generation is living an unreal life. We don't see the sun. We don't see sunlight.
What is the sun?
I'm in the sunlight. I'm in the sunlight. See, one of my friend always jokes, if you have a patient, you can't find a problem, just say, let us check the vitamin D level, because 99% of people are deficient in vitamin D and you look like a clever doctor. So I think our lifestyle or this present generation is still worse because they are subject to a lot of stress, lot of targets, social media pressures. You have to perform whether you are a student or you are wherever you are. And there are a lot of expectations on you from society. So stress is one of the, stress itself will not cause heart attack, but it can speed in. Say if you have diabetes, stress can make diabetes worse. Stress can induce diabetes. If you have high blood pressures, or stress can induce high blood pressures. So what are your risk factors is, first of all, you will have to look in whether am I having a healthy lifestyle. Am I sleeping 8 hours a day? Am I a smoker? Smoking is bad for you, full stop. How many cigarettes can I smoke? Zero. Answer is zero. No amount of smoking is good for you. Good for the heart especially. So smoking, good healthy lifestyle in the sense stress-free lifestyle, good sleep, timely food, yes. And what am I eating? Am I eating a lot of junk food, fast food? One of the problems with the fast food, junk food and all this is, I'm not against them, but we don't know how they are made. So the type of oils, whether you're taking saturated or unsaturated fats. So the best thing I would say is, if you are at least most days of the week, if you're eating at home, you know what is going in to your plate.
Yeah, traditional food is definitely trumps, any form of processed or artificial.
Yes.
What about fruits and vegetables?
Fruits and vegetables are very good. So fruit has to be a part of your meal. And salt. We don't want excess salt in our diet. Salt can cause hypertension, high blood pressure. Salt can retain fluid in the body. So in many ways, salt is not good for you. Salt is equally bad for you as fats. So lot of processed foods, lot of packed foods, lot of farsan, whatever you say, you go to the restaurants, the foods are made tasty because they add a lot of salt. So there is something called as a DASH diet. So for people who have high blood pressure and they're looking at what is my target salt, how much salt should I eat? So there is something called, there are lots of types of diet, but DASH is a good start, DASH diet. So that gives the targets. If you have got high blood pressure, this is the amount of salt that you can eat. And so
they say overall a Mediterranean type of diet is good for the heart and things like that.
Yes, absolutely, because Mediterranean diet includes fish. Fish has got a lot of polyunsaturated fats, which are relatively good compared to the saturated fats like our pure ghee or hydrogenated oils, all these, which can make the food very tasty, but at the same time they can cause problem.
Now, having discussed all these, my next question is, which is the question we started with. Is there a rise in heart attacks, in sudden cardiac deaths in Indian population at a younger age? Are you seeing that? Is it a true fact? Is it like...
Absolutely. There is a rise in heart attacks in young people. We are seeing even people in their 20s and 30s coming with chest pains and having underlying coronary artery disease. Now, why is that? One, there is an increase in incidence. Equally, there is an increase in awareness. See, some actor or a popular personality experiences sudden cardiac death. Instantaneously, it makes news. So everybody knows. Now, somebody goes to a wedding and they experience somebody actually collapses because of the social media. These things make their way into public domain very fast. So we are every day bombarded by these
by these visuals that
by these visuals, and that causes some amount of anxiety, absolutely. And people are also aware that there is increased instance of heart attack in young people, so they are making their way to the hospitals and more reporting of the symptoms. So that could also contribute. But also equally, use of drugs in young people. See, cocaine can cause sudden spasm or constriction of the blood supply to the heart.
Okay.
So there are lots of factors like this that is increasing the incidence of heart disease. Also, we have seen a rise in sudden cardiac death during the COVID time because of the various reasons. The COVID infection is a hypercoagulable state, which makes the blood a little bit thicker. So there is increased propensity to clots in the lungs, as well as clots going into the arteries that supply blood to the heart.
So COVID itself can worsen and cause a heart attack, the COVID
Absolutely.
infection itself.
Absolutely. And also the COVID vaccine, there has been a lot of anxiety at the time. Is COVID vaccine the cause of rise
Very
in
common
sudden
question.
Yes.
It's not even a question. People say that it is all because of the vaccine.
Yes, we know that COVID vaccine, in a very minority of people, can cause inflammation of the heart muscle, what we call as myocarditis. But you have to think the benefits versus the risk. When we are prescribing a medicine, as you know, every medicine has got some side effects. So we look at the risk and benefit. So the risk benefit ratio, in the sense that the fact that vaccine helps prevent the COVID infection itself, and the problems that are caused by the COVID infection are overwhelmingly high compared to whatever the perceived or the real cardiac risk that arise from the COVID vaccine. So the verdict is out. COVID vaccine has saved a lot of lives. There is no question about it. So we still remember when the COVID started, the death was 1 in 15 people, and that came down after the first round of vaccine, second round of vaccine. Now today, we don't hear that much that somebody has died because of the COVID infection.
Itself, yeah. So this was a very important part. And when you mentioned that on social media, you see someone who's like dancing at a function and they collapse. The first thing that you see is people are recording it and the recording has not stopped. And you see in the recording, you will see people rushing over and looking from a close range. But you don't see the action that has to be done, which is we know as CPR, which is something that has to be done. So can you tell us a little more about what should someone do if someone collapses in front of them?
Yes. So I think, having spent more than 20 years in the West, one striking, glaring thing that I find is the general level of awareness amongst public about cardiopulmonary resuscitation, CPR. So if somebody collapses in front of you, what do you do? The first thing that you do is try and see if this person is conscious, is he actually responding to the verbal commands? The first thing you do is you shout, you go and touch, try and shake him to see, is he going to respond? Okay, if he's not responding. The next thing you want to see is whether this person is breathing or not. Okay. If the person is not breathing, is not responding, he has had a cardiac arrest. And we have already discussed, if your heart does not beat for 4 seconds, heart supplies all the vital organs with blood supply, and the most vital organ for you is the brain. If the brain doesn't get blood supply for about 4 seconds, you can lose consciousness. If the brain doesn't get blood supply for about 4 minutes, a person can be brain dead. Okay. And when somebody is experiencing sudden cardiac death, our data shows every passing minute, the chances of survival decrease by 10%.
So
Yes.
every minute, the chance of this person surviving reduces by 10 minutes.
Unless you do something. And
By
what can you
10%,
do? So by the end of 9 minutes, if you're standing and watching there, by the end of 4 minutes, the person is brain dead.
Dead.
At the end
Or
of
10.
9 minutes or 10 minutes, the person is dead.
So it's like a golden period to do something for that
Absolutely.
person.
Anybody can save a life. If you have witnessed a collapse in front of you, don't wait for somebody else to do something. You can do something. The best thing that you have to do is that when you have found that somebody has had a cardiac arrest, the first thing you have to make sure is somebody calls for an ambulance. So you are doing the CPR and you're not getting any help. CPR is only a bridging period. So CPR basically means you are trying to make the heart pump externally.
Correct.
And how we can do that? We place both our hands, keep our elbows straight. We find the lower third of our sternum or the chest bone and try and do compressions. How much do we compress? About 3 to 4 centimeters. We try to compress, and how fast? About 100 to 120 times in a minute. This has to be carried on continuously until the ambulance comes.
So a simple way to remember this is you push hard, you push fast, and if you're a Bee Gees fan, you go to the rhythm of staying alive, staying alive. So that's the rhythm that you keep following.
Yes.
Till the ambulance comes.
Absolutely.
You don't have to sing, but you can just keep.
Until the ambulance comes or the person wakes up.
Or the person wakes up,
Yes.
yeah.
So,
but you still make sure the person goes to the hospital and gets checked.
Absolutely, absolutely. So whilst you're carrying on CPR, one of your friend should go and call an ambulance. That's number one. If you are a group of friends, you should make sure that you take turns. So one
you
person
don't fatigue into
you
that.
don't fatigue, and the person himself is putting into stress, and he may not be able to do a good job. So you have to rotate. And number three, when somebody has had a cardiac arrest and you are trying to go and resuscitate, jump on him, make sure that you are in a safe surrounding.
The scene safety has to be assessed.
Scene safety has to be sort of first assessed.
It's a very beautiful thing that you've said. So at least what we will do is we'll just put up a few links from what you have shared with us.
Yeah.
And we'll put it up as in this part of our discussion so that people who are more interested can definitely look it up and train and take it forward.
Yeah.
One line that I loved about what you mentioned, I'll interrupt you before you can go on. One line that I loved what you mentioned is, it is not necessarily a cardiologist or a surgeon or a physician or a doctor who's saving your life. It could be anybody at that scene who has that basic knowledge of CPR who can save a life. So you don't need to be a doctor to save someone's life. If you're trained well in CPR, you could be anybody and you can save that person's life. So there was something beautiful that you said.
The most important thing is do something. And the other thing that I notice is most of us, including you and me, I guess, we don't have a phone number of an ambulance in the house. See, most of the time, a family member collapses and the family is running for help, calling somebody on the phone.
They call the neighbor and the neighbor
they are
calls
not
someone
focusing on the resuscitation. That is number one. Number two is they don't have an ambulance number. So I request everybody to at least make a backup plan. So if a family member collapses, who do we call? How do we call the ambulance to save?
to have that emergency contact. Yeah.
Yes, number. That is the most important number for you in the telephone directory at that moment in time. Yes. So the ambulance access, where do we go? Where is our nearest sort of ambulance? See, the beauty in the, well, I wouldn't say where we try to achieve as Indians is in America or in Europe, if somebody collapses and you call for an ambulance, the ambulance comes within 4 minutes.
Okay.
At least they try to. So there are different ambulances, various places. In our Mumbai, even if an ambulance comes, we may be stuck on Western Express. We may be stuck in traffic. So there are different things. So the awareness of the CPR is all the more important in India because you can do something.
It's very important for
you can
everybody.
Do something.
Yeah.
Yes. When the ambulance comes, the ambulance crew are equipped to put a airway tube
and things
they
like
can
that.
start a line, they can start fluids if somebody is bleeding internally. See, whatever the cause, the person has stopped, his heart has stopped.
So that's something that needs to develop more, and there's a huge area of need for that.
Yes. And say if somebody has had a cardiac death, sudden cardiac death, what is the message for the family members? The rest of the family members also have to go to a doctor cardiologist, their first cousins, because there are some congenital hereditary conditions which can make you prone for sudden cardiac death. So
So
sometimes
if you have
I
a
have
history of sudden cardiac death in the family,
family
better to get it tested.
checked. So what are the checks that they're going to do? They're going to do an ECG, which is an electrical rhythm. That's number one. That will tell a lot of abnormalities that you're born with if you have any abnormalities. Secondly, they'll do an echocardiogram. So are you somebody who's got a cardiomyopathy? Means suddenly your heart muscle has decided to
The
become
muscle's
weak.
not working in a right way.
That's number two. Number three, you have now genetic testing as well. Thanks to development in technology in the last 10 years, now we have genetic testing for some panel of cardiac diseases. So they can test whether,
Super.
yes. And then if somebody had a sudden cardiac death and they have been successfully been resuscitated and they have been told that they have got specific condition, you can check that person and check the family members and first cousins whether they have got the same genetic
Same
abnormality.
genetic normal.
So there is a lot of things that can be done. So that has all happened in the last few years. So that's the most important. And then the other thing that I would add is, in the West, every building has got a defibrillator.
Just coming to the defibrillator part.
See, sudden cardiac death can be caused because of electrical rhythm disturbance, which
Correct.
can be put back to normal by shocking the heart.
So for those, whenever you go to an airport or a mall, you'll see that box. It says a defibrillator. It's got that electric lightning sign and a red box there. And some gyms have it. Some societies have it. So what is a defibrillator? Can you just explain it to?
Yes. So when somebody is having a sudden cardiac death, as I said to you, sudden cardiac death in a overwhelming majority of people is because of lack of blood supply to the heart, because there are three main blood vessels that supply blood to the heart, and that part of the muscle that is supplied by an artery which gets blocked. So that muscle is becoming unstable. So electrically unstable, and then suddenly it throws off impulses which randomly cause
Like a lightning
yes,
effect
absolutely. It causes a big chaos in the heart very fast, and heart rates go above 350. So when the heart is beating at 400 or 500 times a sort of minute, so there is no proper contraction and it's not able to effectively pump the heart.
So it's going so fast that it just
Yes, it's
becomes
just
silent.
moving
Yeah.
like this. It's called fibrillation. It's called ventricular fibrillation. Ventricles are the bottom chambers of the heart, and it's just fibrillating. It's not contracting. At that moment, if you can deliver a shock to the heart, it can put the heart back to normal rhythm. And the job of a defibrillator, you must have seen people shocking from outside.
Yeah, that in those serials that you see, medical serials, they say chalk and
Yes.
That's what.
And these external defibrillators that are placed in airports and other places, they have a couple of paddles. So you will have to break the glass first and then take the thing, break the glass or open that box and put those paddles on the chest. And they are very self-explanatory. The paddles have got a picture where to apply
it
on the
also.
chest. So
Yes.
one on the sort of right top side of the chest and one on the left
Right.
side of the chest. And that is connected to the defibrillator, and you switch it on.
Yes.
It is all self-explanatory. There is a voice
gives you
that comes,
instructions
instructions says that this is a shockable rhythm, please press the button.
Press this
so you
button.
press the button that, and then it stays, and it says continue CPR.
It reminds you to do the CPR.
CPR,
So
yes.
this is a very important part. So if you have someone who's collapsing in front of you, say in a mall or at an airport, you assess the scene safety, check if they're arousable, if they're conscious, unconscious, and call for help and do the CPR and ask for a defibrillator. So these are all the steps that
Yes,
can organically
Whilst
be done.
you're doing the CPR, somebody else can run, find out if there is a defibrillator. Don't say, I've never used a defibrillator, I don't want to use it now. It is all self-explanatory. These are meant for lay people. So just open the box, it will all explain what to do. And once the ambulance comes, they try and resuscitate. What do you do next? You take them to the nearest emergency department where there is a cardiac cath lab assessed by a cardiologist and the doctors to see whether the person is having a heart attack, and then they take them to the cath lab, look at the artery and open the artery. So there are so many success stories which don't make their light to the public domain, because this is what we do day in and day out. Because every hospital, if you talk to the people that work in emergency department, they have loads of stories to tell about young people.
Can you share something with us? Anything that comes to your mind? Any anecdote that you've had recently?
Oh yes, I think I'll tell the story of my colleague. When I was working in UK as a consultant, one of my colleague consultants, he's in his mid-50s, and he went to a movie with his daughter. The daughter was about 20, 25, and she's not a doctor. And it's just like a father-daughter bonding, and they decide to go to this movie. And in the middle of the movie, he suddenly loses consciousness. Yes, this is a real story. So he suddenly loses consciousness. And what does the daughter do? She stands up and shouts at the top of her voice, "Hey, my dad is not breathing, please." So immediately they stop the movie. They start resuscitation on him. Ambulance is
In the
called.
theater, in the movie hall.
In the movie hall. So they start the resuscitation, and this guy is rushed off to the nearest casualty, and then he is having a heart attack, and he's taken into the cath lab, and he gets the stent put in. The artery is opened using a balloon, and then a stent is put in, and then the course of recovery. He stays in hospital for a few days and rehab, and now he's back to his job, and he thanks every single day of his life his daughter for doing what she has done at that moment. She did not shy away thinking what people will think, or she did not wait for next 10 minutes for her dad to wake up.
And
What she did, she didn't care anything. Now she knew, being a daughter of a cardiologist, whatever, that if she doesn't take an action immediately, no matter what, and where else to be in the worst place, you are in a theater, people are engrossed, and such a loud music,
correct. But
for a young girl to be shouting for help. So this has moved me both in terms of emotionally knowing the father-daughter and how she saved the life. And that's a big message for everyone. If you see somebody lose consciousness, if you're a family member, don't wait, do something.
Yeah, so losing consciousness means that there is a probability that definitely blood is not going to the brain, which means that could be most common cause could be the heart. Most common cause could be something like a heart attack. So why take a chance? You should take immediate action. Don't just sit there. Train and educate yourself.
You start the CPR, the worst case scenario, the person might wake up. He might push you away. That is the worst case scenario. But as I said to you, you should check whether he is responsive. You should check whether he is breathing. And if you can check the pulse, that's all the more good. You can check the pulse in the neck. But if you can't, it doesn't matter. Just go to CPR.
And so now, as a palliative care person, when we do cardiology, and palliative care in cardiology is something that is practiced in UK. In India, to a certain extent, it's still not as widely practiced as palliative care in cancer, for example. So there are a lot of people with chronic cardiac conditions who come to palliative care. What is the role for, say, what do you foresee the role for, say, physicians or nurses, palliative care specialists, for people in whom, there is no cure possible for some of the electrical problems of the heart? What is your recommendation or advice to the palliative care community who's listening to this?
Absolutely, because there is something called end of life. Yes. So everybody wants to die in dignity. When I have a condition that can't be cured, and I have had my life, or I'm an elderly gentleman, and I want to end my life with dignity, I don't want somebody to come and jump on my heart, try and start resuscitation, try to bring me back to life when I have peacefully breathed my last. So this end of life care is very important. So everybody who has got a critical condition, a condition that cannot be cured, should think about making an advance directive. Means what are their thoughts? Yes, what are their thoughts about being resuscitated? So this happens often in the wards, medical wards, when somebody is extremely unwell, sick. We talk to the patient. We say we do the best treatment, but if nature takes its course, if your heart were to stop beating, or if you were to stop breathing, do we let you go at that time? Or do you want us to try and restart the heart? Now, again, I make this clear, it's not the decision of the patient. We just include the patient in the decision.
Because we sometimes know
medically, it is the ultimate decision lies with the doctor. Whether, sometimes you may end up situations in your over enthusiasm, you try to resuscitate somebody, and the patient might end up brain dead, and they have got a chronic condition, and the family are not able to cope with the whole scenario. So this is a very unpleasant discussion for the family and the patient, but it is a very, very necessary decision.
Because you said that word, you said dignity.
Dignity, yes.
That treating that person as a human being first.
Yes, yes. If you have an incurable cancer, how would you want to spend your last week of life? You don't want to spend in pain. You don't want people jumping on you and trying to do the resuscitations. you want to have your quiet time with your family, and that's where your palliative team comes in place. They make it as
Comfortable and pain-free.
as comfortable, and there are some problems that come with the end of the life. Those only the palliative team can answer, understand, and assess and address. So
Thanks for actually mentioning that. Now, as an expert in this, I just want to understand some statistics. So, when you witness a cardiac arrest, say this is not palliative, I'm just talking about community, you see a cardiac arrest. If this person starts CPR, what is the chance of resuscitation and good outcome in this patient, roughly?
sure, the out of hospital cardiac arrest.
Out of hospital.
Yes, out of hospital cardiac arrest. Every passing minute that is gone, you have not started CPR, you have not done anything, the chance of survival reduces by 10%.
10%.
So, if you start CPR within the first minute, then probably you stand a chance if the ambulance comes in time,
Yes.
and you find your way to the nearest hospital and all these things. But if you don't, within the first 4 minutes, if you don't start the CPR, the person is likely that even if you try and restart if you start the CPR and resuscitate that person, he would have had some amount of brain injury.
Damage.
And as all of us know, when there is a brain damage, its brain is a very complex organ. To what extent it causes damage, whether the person is brain dead or he's just lost the power in all his limbs or lost his comprehension, we don't know. So the quality of life is there, it is not there anymore. He is not the same person that the family has once known. So and every passing minute, as I said, there is a decrease in 10% chance. So by the end of 9 minutes, the chance of survival is 0. As such, the cardiac arrest survival in India by the time they come to the hospital is less than 20%. I mean, the because of the way our society is, how many people are resuscitated and how fast they are brought to the hospital.
So, is it how less or how different is it from the Western statistics?
Western statistics as well, the out of hospital cardiac arrest, the survival rates are very poor, but they are much better than India. But because of the ambulance service and how the traffic moves around to make way for the ambulances, and the general awareness of the public and the sort of availability of the defibrillators.
So we asked you for some links and other things that we can put up during our podcast, so that the general public who are more interested, or anyone from who's listening who's more interested in knowing more about it, they can educate themselves, and links. We'll ask you for some resources also.
Absolutely. There is a very beautiful video done by Philips on I think Philips, yes, on how to do CPR, how to send somebody for a defibrillator, and when the defibrillator has been put in, how that person is resuscitated, and then the ambulance takes over. So that is a 3-minute video, but that really sums up everything that I have said in the sense.
Yeah, and one other thing, so but the last couple of questions that I have for you. One of the things is, you hear this situation where they say someone had a sudden shock. They hear a shocking news and they get a heart attack. And is how real, or how, I mean, it is observed. So what are the statistics? Can you say a little more about those sudden shock causing?
Absolutely, the sudden shock, stress, catecholamine, adrenaline, sudden increase in that can cause your blood pressure to go up, and the sudden change of hemodynamics in the body can cause
so many factors
problems with the heart. There is something called as a broken heart syndrome as well. When there is a sudden bad news, loss of a loved one, people present. It's also called
Takotsubo
syndrome, and that is a very well known phenomenon. So yes, stress has an impact. But I am not entirely sure exact statistics because this being not very common, it's very difficult. So, but only one thing I would say, because coming down, how do we prevent sudden cardiac death? Well, we cannot prevent the sudden cardiac death, but we can certainly take care of the risk factors and how we can protect ourselves. So I would say, irrespective of where you are in your journey, whether you are a 20-year-old or a 40-year-old or a 60-year-old, a good lifestyle, there is nothing to beat, replace, and it's never late to think of a good lifestyle. Good lifestyle, I eating good sort of food, at least conscious of what I am eating, even if you eat outside or at home. Good sleep, trying to avoid excess stress. And if you are a young person, drugs are not good for you. It may be fashionable. Using drugs, smoking, excessive alcohol, all these things may be fashionable for the night, but they are extremely deleterious for you, and they can cause sudden cardiac death also.
So basically, what we have understood is that with Dr. Venkat's extensive training in the United Kingdom and multiple degrees, he's basically telling you what our grandmothers used to tell us all the time. So eat well,
Yes.
sleep well, have stress-free lifestyle, meditate, don't smoke, don't drink. Good habits really is the best way to take care of longevity for your heart and take good care of your heart, isn't it?
Absolutely. And if you are a middle-aged person, and if you have not already done so, please check if you are a diabetic, because diseases like diabetes and high blood pressure, they do not cause symptoms.
The silent killers, they call it silent
only way
killers,
they
yeah.
cause symptoms is by causing the organ damage. By the time organ damage has happened, so somebody might present with a kidney failure, and they have had blood
Then
pressure
they know
for
that
10
they had
years.
diabetes for so
Yes.
long.
So you have to go to your general physician, general practitioner, to ask, am I a diabetic? Have I got high blood pressure? What are my cholesterol? If you don't ask, nobody is going to ask.
Yeah, and you have to take that initiative to empowering people with that knowledge about taking care of their health. And one beautiful thing that you mentioned is that we cannot stop sudden cardiac death.
Yes.
Nobody can stop death. But what we can do is at least make ourselves aware, follow basic principles for CPR, take care of it. Also, to summarize, one of the things that you mentioned was the concept of dignity. For someone who has an incurable condition, and we know medically that the chance of survival is very low, we have these risk factors, and we have an understanding now with so much statistics, we have an understanding of what's going to happen. At that point, to treat them with dignity, not try and do aggressive, or at least give them the information that doing the CPR may not cause harm, it can cause more benefit. It may not cause more benefit, it may cause more harm. So those are the things that we should also explore. So it's a very a beautiful thing that you mentioned, about all of this. This brings us to the question that we ask all our guests on the show. What does living well mean to you?
See, I think living well means to what does it mean to me? Because we make so much fuss about birth. When somebody is born, everybody is happy, the pregnancy, 9 months, and you come into the world, your parents are happy, everybody is happy, and then you are at some point in time left alone on your own to take care of yourself. And then you come to a stage where your kids are taking care of you. Okay. So at what path you are in your journey is very important. At the childhood, your parents are taking care, which is not in your hands, what they have provided and how you are. And when you are taking care of yourself, you have to, all that we talked. And then when it comes to our kids, I would say the end of life is very important. Dying with dignity. So the death is a celebration as birth, but let's do it with dignity. So for me, living well is going through these 3 phases where I don't have control on phase 1 and phase 3. But the middle phase, I want to make best use of my life, try to take care of myself, and live an independent and happy life.
Happy life. So beautifully said. Thanks, Dr. Venkat, for saying this.
Thank
and
you.
Thanks
Thanks
for
for
being
having
one of the
me.
first cardiologists on this. And we look forward to many more specialists coming and sharing their knowledge with us. You've taken time from your very busy schedule. So thank you once again.
Thank you very much. Thanks for having me.